You're very welcome to today's talk. It is Friday the 19th of February 2021. Now, I've got some international news to give you today. There's some not so good news out of Japan, and there's some transatlantic trends which are still looking pretty favourable, it has to be said. But I want to start off with a good news paper. Now, were the UK authorities right to go down the one dose of vaccine route, delaying for up to 3 months on the second dose? Well, I think people are pretty well agreed that it was the right thing to do with the Oxford vaccine, the Oxford AstraZeneca. Indeed, there's evidence of improved efficacy with a longer time delay, but with the Pfizer there wasn't. But Israel is really quite a long way ahead with its vaccination program, so we're starting to get really rich data now out of Israel. And that's what this paper is based on. Now, it's Norwich Medical School has conducted this study, but they've taken primary Israeli data and analysed it. And the news is good. Let's have a look at it. So, estimating the effectiveness of the Pfizer COVID-19 vaccine after a single dose. So, a reanalysis of real-world vaccination outcomes from Israel. So, this is not a trial. This is the real thing. This is it being used in anger. And Israel's just ahead of the curve in terms of chucking out all this data, because they're ahead of the curve in terms of the number of vaccines that they are giving. Large proportion of the population vaccinated already. We'll be checking on that later. Relatively small population, of course, so it is attainable. Now, this analysis was completed by Norwich Medical School on the 1st of February, so obviously a little bit out of date, but it's still pretty good. There was a lot of vaccines given in Israel by the 1st of February. Right, we extract the primary data from Israel too. So this is them speaking. They've extracted the primary data. They've gone back to the source of the data to estimate the incidence per day. So that is the new cases of COVID-19 per day for each day after the first injection. Now, there was so much data available, they were able to do this on a daily basis. So quite impressive, because we've got large amounts of data. So estimated number of new cases per day for each day after the first injection. Now, the number of people involved here were 500,000. So this is like, 15 times the size of the clinical trials. This is real world data sets starting to come in now, and we're going to get way more of this. I mean, pretty soon from the United Kingdom and the States, we're going to be looking at data sets with millions of people in, and we'll have really precise information from that. But 500,000 is not a bad place to start at all. A retrospective cohort study, so looking back at this group of 500,000. Now, the infections over the first 24 days, there was 3,077 infected. So of the 500,000 people that were vaccinated, in the first 24 days after the first day that they'd had the vaccine, well over, or 77 over 3,000 of them were infected. Now, that sounds like a lot, but in actual fact it's not, because if you remember these clinical trials, you'd be looking at a clinical trial of 30,000, you get about 150 people that were infected. So this is slightly more, but we'll see why that is in a minute. There's a good reason for this, actually. There's a very, very significant reason for this. So days 0 to 8. So we give the injection on day 0. That's when the vaccination is given via intramuscular injection. And this data is all about the Pfizer vaccine. It's only the Pfizer vaccine so far that we have this data set from Israel. Now, days 0 to 8. In those first 8 days after people were vaccinated, their likelihood of getting the disease doubled. Their likelihood of contracting the infection doubled. So for the first 8 days, they were more likely. So that would give a negative efficacy of the vaccine of, I guess, 50% in those first 8 days. They were double what they were, times 2. Now that is... that doesn't look good, does it? So you give the vaccine and you're twice as likely to get the infection. But what this must mean, because we know there's an immunological response from just a few days after the vaccine, but we know it's not significant for 3 weeks. But why would cases double in the first 8 days? Is it that the vaccine is suppressing the immune system for those first 8 days? Well, I think that's highly unlikely. that the vaccine is actually suppressing immunity for that first 8 days. Although you could argue that the body doesn't fight off 2 infections very well at the same time, it's much better at fighting off 1 at a time. So if it's producing an immune response against the antigen in the virus, the antigen in the vaccine rather, does that mean it can't fight off the virus as well? You could argue that, but I don't think it's true. I think the answer is fairly obvious here, and this is what's suggested by the authors. In the early days of the vaccine, people didn't realise it takes 3 weeks for vaccine efficacy to kick in. That's the big problem. So people were thinking, I'm vaccinated now, I'll just pop off and see someone, or pop off and do something, or not bother wearing a mask. I think this is behavioural. So absolutely critical that for the first 3 weeks, there's no increase in immunity after the vaccine. So this was early days, but these people should have known. In fact, they did know they had to maintain the safe behaviour. Looks like a lot didn't, and that's what caused the increased rates of infection. And in fact, we can see this on this graph here. So here's the vaccine given here. So this is daily incidence of new infections by day from the first dose. And we see it goes up for the first 8 days. So there's 8 days there. So after the vaccine, the incidence goes up. And we see it goes down quite nicely after that, but we'll come back to that. So there we go. Salient message, if ever one was needed, that this immunity is not kicking in significantly for 3 weeks and behaviour must not change. In fact, even after 3 weeks, behaviour should not change, but certainly not in the first days. So days 0 to 14, estimated vaccine efficacy or effectiveness was pretty much 0. So it went from the first 8 days to causing more infections, but we believe for behavioural reasons. Then day to 14 for the first 2 weeks, no difference at all. Might as well not have bothered. Zero difference for the first 2 weeks is what they're saying. Interesting. But then, day 8 to day 21, new cases declined. So it probably was a good idea after all. But we have to wait. So there was a gradual new cases started to decline day 8 to day 21. And at day 21, this is staggering, they are saying the vaccine effectiveness was 91%. Now let me reiterate, this is after a single dose. This is impressive. This is very impressive. Now in Israel they are giving 2 doses, but they're able to collect this interim data between times. So let's look at that on the graphic now. So daily incidence of new infections, so they went up, 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 then they went down, 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 and they went all the way down to day 21. And then although they seem to go back up, this is basically level here. So wow, look at that massive reduction in new cases by day 21. This is impressive vaccine efficacy. And if we look on another way of presenting data, estimated vaccine effectiveness on each day from day 13 to day 24 after a single dose. So this is estimated vaccine effectiveness. So on day 13, it was still going down. No difference on the first 14 days, apart from the first 8 days where things were worse. And then look at vaccine efficacy go up day 15, day 16, day 17, day 18. Wow, I mean, and then up to day 21 where we are at 91%. And then basically it levels off after that. This is just incredibly good news, and it's also really good news for the UK policy as well of giving a single vaccine in the first instance. And after 21 days, it remained at 90%. So pretty good stuff. Now the conclusions, how long is this going, before the conclusions, how long is it going to last for? Now the data so far goes up to 9 weeks. So what we can say so far, because this is the data that we have, and remember this is from 500,000 people, that 90% immunity is maintained for the first 9 weeks. Now, if it's maintained at 90% for the first 9 weeks, it's not going to go at 10 weeks like that. It's not going to drop off a cliff. immunity would only wane very gradually, very, very gradually. It wouldn't just go down quickly. So we know it's 90% for 9 weeks. And expectations are that this level of immunity will be maintained from 9 weeks to 6 months. We don't know how, we don't know, the time hasn't elapsed yet. But that is what these authors estimate, 9 weeks to 6 months. So that means if we're revaccinating with the booster dose within 3 months, that's really quite good. That's hunky-dory. We're happy with that. So conclusion from this Norwich University study. A single dose of vaccine is highly protective. The early results coming from Israel support the UK policy of extending the gap between doses. This is working and is a contributing factor to the UK's encouraging vaccination response. A couple other points though. Also, vaccine effectiveness seems to be better at reducing severe disease than reducing mild disease. So it's reducing mild disease here by 90%, but it's even better at reducing severe disease. So what we can say from this paper is that the likelihood that you'll get severe infections, the efficacy against severe infections, is 90% plus. It's more than 90%, and it's probably getting on to the high 90s, and even in the clinical trial data, actually, as you remember from the phase 3 clinical trial data, it was 100%. There was no one being hospitalised after 3 or 4 weeks after the first dose of vaccine on the Oxford AstraZeneca data. The data in the phase 3 trials actually wasn't really collected in the Pfizer vaccine because they were planning on this booster dose after 3 weeks. So, but in principle, all of the vaccines, this was the case with the Sputnik vaccine, that it was preventing pretty well 100% of hospitalisations and deaths. Remarkably good news, and that's why we were unhappy with South Africa for not using the Oxford vaccine as well. A decision that they haven't reversed yet, as far as I'm aware, in South Africa. Therefore, more than 90% protection against severe disease, hospitalisations and deaths. Wow. Good news. Impressive, very impressive graphics there from Israel. Now, let's move on to not so good news. Just before I move on to the not so good news, let's just be clear. This is clear support, large number support of the UK policies. So it's good, very good. Japan. Now, COVID-19 variant of concern involving where the E amino acid is converted to the K amino acid, and this is the 484, and this is it again. This is in the spike protein. So new mutation there looks like identified in Japan. Now, it didn't arise in Japan. It's an infected cluster in an immigration facility. This is people coming into the country. So it looks like it's come from abroad. Too early to say where. But the Japanese authorities are really quite concerned about this, which is why I've included it. They really are worried about it. Direct quotes, it may be more contagious than the conventional strains, that's likely. And if it continues to spread domestically, it could lead to a rapid rise in cases. So clearly they're worried about the sort of, well, it'd be the third wave for Japan now, really, but this massive increase in cases that we suffered from in the UK, December, January, is possible in Japan because of new variants, and they're worried about that. And of course, the Olympics just look completely unrealistic to me, I'm afraid. Now, let's move on to the UK. Let's look at some simplified numbers first. UK data. So number of new cases in 24 hours, still not gone away, it's still high, over 4 million now. Another 12,000 people infected in 24-hour period. Deaths going down really quite slowly. Okay, they're half what they were a couple of weeks ago, but still 454 deaths in a 24-hour period is a lot. This is the number of deaths within 28 days of a positive diagnosis. This is the number of deaths where COVID-19 is likely cause of death on the death certificate. and that's the number of new likely causes of deaths on the death certificate in the last week. So death rate in the UK now we can clearly see as 130,000 people have died. Now, how's the vaccination programme going in the UK? First dose over 16.5 million now. Second dose just a few. We don't need to start giving the second dose yet for reasons we've just seen. Week ending the 14th of February, in the 7-day period up to the 14th of February, we gave nearly 3 million doses. This is encouraging. No two ways about it, it's encouraging. Now let's just look at some data from the UK now. So here we see the drop-off in cases, which is reassuring to see, but still nothing like as low as we would need it to be to have a significant opening up again. The reason for that, of course, is the healthcare provision, which is still under strain. I mean, this is going down a lot, but this was horrendous up here. So still quite a few new people being admitted to hospital. And in terms of those in hospital, going down more slowly. So healthcare facilities still really quite stretched in many, many areas. Deaths in the UK, well, they are starting to drop off now quite rapidly, as we've seen, as we would have expected, as we did anticipate because of the new the drop-off in cases. But still, we've got a bit to go. And I think while we're here, we just look at the American equivalent site, the Centers for Disease Control. Drop-off in number of cases in the States, again, looking good. There are slightly less tests in the United States, but way less hospitalisations in the United States, so that's looking good. What's taking so long to come down, though, in the States is the deaths. They are coming down, and they've actually gone down a bit since this. Well, this is actually live time, but they've actually come down a bit more since this graphic's not quite updated. But that's a live link to the website. But deaths remaining stubbornly high in the States. But let's look at some broken down figures on that. That was the UK. This is the US CDC. Now the trends are daily new cases down 28.1%. I mean, that's a good sized drop. That is good. New daily reported deaths, as I said, they are down more than that data there would indicate. They're actually down in the past 7 days. They're down 26.4%. So we will see this continue to drop down quite substantially, and not before time. It's been at a high plateau for some time. Hospitalizations in the States down 16.1%. Still 62,000 people in hospital with COVID in the States. So again, not gone away. Test positivity rate continues to go down to 5.1% nationally. Vaccination doses since the 14th of December looking good, 59 million nearly. And 16 million have had the second dose. That's 5.02% of the entire US population. So let's just have a quick look now at the vaccination status around the world. And these are all on, if you want to see these, I'll put a whole list of these. This one we're looking at here is the Bloomberg, that top one, but there's quite a few others. European, there's all sorts of vaccine trackers there for your perusal. I've clicked on all these links myself. None of them gave me a virus, so a computer virus. So I'm happy to leave them in the description. That's the wrong one. I want that one. There we go. So let's have a look. Interesting. China is increasing now. Now 2.9% of the population, relatively low, but of course there's well over. How many people are in China now? Is it 1.1 billion or something? Anyway, so it is making a start there in China. Russia, likewise, much lower population in Russia, of course. Russia, not overly impressive, to be quite honest there. United States. So, of course, we've got to bear in mind 18 doses given per 100 people. That's 12.6% have got the first shot because 5.1% are fully vaccinated. So in the UK, we're going for the different strategy of the single shot followed by a 3-month delay. And they're up to 25% of the people basically have had the first shot. Therefore, in 3 weeks' time, important to stress, in 3 weeks' time, or 3 weeks after this 24.6% have had their first dose, we will see hospitalisations and deaths drop down dramatically. And notice that I didn't say we hope to see it. We will see this go down dramatically. Deaths and hospitalisations in the UK are going to go down dramatically March, April, because the vaccines will be kicking in, because the highest risk groups are being vaccinated. They will go down. And even although the cases in the United States are probably going to go up in March, as we've said, because of the new variants, overall death figures will not return to where they were because, again, large swathes of the at-risk population are being vaccinated as we speak. In 3 weeks' time, when the numbers of cases probably will start going up in the United States, those vaccines will have kicked in and those people will be largely protected against severe disease, hospitalisations and deaths. Largely protected. Much, much better than the previous wave. So in other words, the link between new cases and deaths is being broken by vaccines. That's what this means. And it's remarkably good news. Now, European countries, poor. France, 5.1 dose, 5.1%. So only 3.7% of the population have got a single dose in France. Germany, not a lot better, to be quite honest. European bloc not doing particularly well. Turkey is doing a bit better. UK is doing substantially better. Now, United Arab Emirates was doing quite well. 50% there. Doses given to 50% of people. Bahrain was also doing quite well. But it's a small population, Bahrain. It's a bit like these odd places here where they've got a batch of vaccines and it does just about everyone in the country, like Maldives and Seychelles. Places I must say I've often fancied visiting, but I don't expect I ever will. Anyway, Norway, 6.4, Sweden a bit less. Anyway, Israel, right, so 46.6% of the population got at least one shot, and they're going for the two-shot policy. 31.4 are fully vaccinated. So what this means, this is great. This is great, of course, for the population, but it's also interesting for us because we're going to be getting a lot more interesting data from Israel. And so far, as we've seen, the data is strongly supporting vaccine efficacy with the Pfizer vaccine and supporting the one-dose strategy, which I must say we did support on this channel even when the data was incomplete. It just kind of felt right, really. So many vaccines we give one dose and then the second and the third dose are just boosters. This is not something sort of new in immunology. Okay. UK vaccine donations. Now the UK, it turns out that the United Kingdom was really quite proactive. Wasn't sure when went back in phase 2 trial days, even phase 1 trial days, what vaccines were going to pan out. We didn't know then. Now we know. But it's, if you go to watch a horse race, you don't know which horse is going to win before the race starts. It's not quite as simple as that, because there was a strategic scientific analysis made, but the UK basically backed quite a few vaccine horses, and quite a few of them have come up. So we've ended up with way more vaccines that we need. Now, we haven't got them yet. We're still waiting for more vaccine supplies, as indeed are other countries. The United States are. Canada, there's just a few more vaccines have been delivered to Canada now, so I'm expecting Canada to pick up quite dramatically soon. But supply is still the issue. But come summertime, it won't be. We're going to have way more vaccines than we need. So we've ordered 400 million doses, population's about 66 million. Even allowing 2 doses each, then we've still got some spare ones. Now, the Prime Minister, Boris Johnson, has been addressing the G7, these sort of rich countries groupings. They're going to donate most of the UK's surplus vaccine supply to poor countries. So here we have a commitment from the Prime Minister to donate, not sell, donate these extra vaccine supplies to poorer countries. And that is now, he said that publicly, that's an announcement, that will happen. They're going to be donated. Remarkably good news. Numbers will depend on boosters required, so will a third dose possibly be required at the end of the year? We don't know. If it is, it will probably be a second generation vaccine. So I would suspect, what's 100, so 66, that's 132, is it? 132 million doses we'll need. So we're going to have loads of spare doses, well over 200 million spare doses, which are going to be donated to poorer countries. Now, this is interesting. Now, the Prime Minister at this G7 meeting urges all countries, or certainly all rich countries, to have a 100-day vaccine target. Now, what is he talking about? Well, previous vaccines have taken a decade or many years to come to fruition. This one, the COVID-19 vaccine, has come in well under a year. It's spectacularly fast, but that's still well over 300 days. Now, we've said repeatedly on this channel, and I'm going to carry on saying it because this is the entire future of humanity potentially at stake here. We've been lucky with this pandemic. Yes, it's transmissible. Yes, it kills people. Yes, it makes people sick. Yes, it's an awful pandemic, but it could have been so much worse. This could have been a virus that spread 10 times faster. That's not an exaggeration. Measles, for example, will probably spread more than 10 times faster. It could have been a highly transmissible virus, and it could have been a completely deadly virus like Ebola. We've been lucky. But the next time we might not be. So if from this pandemic, governments realise that we need a facility where we can take a new virus, or even potentially a bacterium, a new pathogenic microorganism, identify it, what the Prime Minister wants is that 100 days after that, we'll be sticking vaccines into arms. And that with another pandemic, which is 50 times more lethal, 100 times more lethal, could save. I mean, it's not impossible that you could get a pandemic that will kill half the population of the world. I mean, this has happened before. In the Americas, it killed way more than half of the population from smallpox. Probably 90% of the population in many indigenous areas and the Amazon, for example, were killed by smallpox. This could happen. So to have this facility where a new antigen comes in and 100 days later a vaccine goes out could save billions and billions of people. So if that comes out of this pandemic, that's good. Now, it may not, because what will happen is that we'll get over this pandemic in a few seasons, I believe. There might be some residual problems for a few years, but basically we'll get over it. Then people will become complacent. They will go for their short-term aims. Their economic strategies will last for a year at the most because they don't want to wait 10, 20, 30 years for a return on their investments. They want it now. They want it all. They want it now. That's the way humans work. So this will probably be forgotten about. This commitment will probably be forgotten about in another 10 years, 20 years, 30 years, 40 years. Another pandemic will come along and can kill even more people. That's probably what's going to happen. But let's hope not. Let's hope that people have actually learned this time of this existential threat and that they act on it. To be fair, in the UK we've got two massive vaccine production facilities coming online. One was planned, I think one's fairly new. The Oxford one was planned. I think the one in Norfolk, I think, is a newer one. So who knows? Just maybe we might actually learn something from this. Emmanuel Macron wants 4 to 5% of Western vaccine supplies to be going to poor countries. Although, to be quite honest, 4 or 5% of the current French supply of vaccines would be a pretty small number. They haven't done very well. Now, James Cleverly is the government minister concerned. He's the minister for Africa and the Middle East, I think, from memory. Looking at the figures, are significantly greater than that. So he'd been challenged, I think, at 5%. So he's saying no, it's going to be way, way more than that. and the government's committed not to use it for short-term diplomatic leverage. So that's good, and it's going to be a global force for good. I really hope it is. And he did say, unlike some countries. So it seems here that Mr. Cleverly is saying that some countries are using vaccination not for the global good, but to further short-term diplomatic leverage. I can't think who he would be thinking about, but it looks like Mr. Cleverly's got some countries in mind there. Anyway, the UK supply will partly be going to COVAX, the United Nations supply. Let's hope officials in the United Nations take care of this. The World Health Organization has not been very proactive in some aspects of this pandemic. Anyway, the UK is committed to more than £500 million. That's getting on for $1 billion. And it looks like Mr. Biden is about to commit to $4 billion. $4 billion. Oh, now if you haven't got the COVID symptom tracker app on your phone, download it. And the reason this is the end of today's video. We're now finished, and I'm just going to talk to you because they put that on to remind me. So I was just about to have a bit of a kip yesterday afternoon, and the phone rang. And they said it's your surgery here. I said, oh yeah. They said, can you come round for your COVID vaccine? And I said, I don't know. Let me think. Do you think I said no? I didn't say that. I said, you're joking, because I'm not due to have mine in. I'm not due to get mine till the middle of next month. I said, yeah, I'll be round. So it dropped everything round like a shot. Absolutely round like a shot. Because what had happened is they were vaccinating another high risk group with the Pfizer vaccine, and of course you can't keep it overnight. So they'd done all the people that they had to that day, and they had a few left over, so they were just ringing round, and basically anyone who was free could go and get one. So I was delighted. So I had it yesterday, tea time, and I tell you what, I feel absolutely fine. Arm a bit sore? Nah, not really. I mean, if it was, I'd be whinging. I mean, I'm not one of these tough guys with a high pain threshold. The slightest little thing and I start whinging. But this is fine, it doesn't hurt. And we're what, 18 hours now, something like that. 18, 20 hours after the event, 20 hours, something like that. And I feel fine. When I say I feel fine, I feel absolutely fine. So no side effects at all. Okay, that may change. Just see what the temperature is. Oh, we'll accept that, 36.8. So no temperature, feeling fine, minimally. My arm's not sore, I can just vaguely feel it. So what does this mean? Well, for the foreseeable future, I behave exactly as I have been doing. And that's going to go beyond the 3 weeks. I behave exactly as I have been doing because I obey all of the government restrictions and lockdown measures, as I'm sure if you're watching this video, you do. So that will not change until the national guidelines change. I behave in exactly the same way. It'll be interesting to know that just out of academic curiosity, I'm going to have no extra immunity for the first 2 weeks. But after 21 days, I should have some extra immunity after that. Quite a lot of extra immunity. And it also means I'm unlikely to go to hospital and die, which is, okay, that's good to know. So no behavioural change. 3 weeks' time, I should have a level of immunity. So I'm pleased about that. I just want the same for everyone in the world now as well, of course. It has been frustrating waiting. I just got lucky yesterday. I should have been another month, really, for my turn to come round. But so I'm not complaining. It was just, I was available. I was there in a few minutes and they gave it to me. Now, the government guidelines say if you are feeling unwell, take medicines to reduce your temperature and things like paracetamol to relieve the symptoms. We had a discussion recently on this channel where there was evidence presented that might actually reduce the efficacy of the immune system. So if you need to take something, yes, you need to take something. If you can avoid taking something because the immune system works best at pyrexial temperatures. Another thing that's probably a factor is having a good vitamin D status, as well as protecting you immunologically from external viruses. Having a good vitamin D status may mean that your immune system is working better, therefore you produce a better immune response to the vaccine. Now, I took the vaccine yesterday, So the vitamin D in my body now, the activated calcifidiol in my body now, has been activated by my liver over the past week, and it's based on vitamin D I took a week ago. So I'm just carrying on taking my normal amount at the moment. But that's going to start benefiting me next week and the week after and the week after, because it takes a week to get into the system. So make sure your vitamin D levels are good. Make sure your general nutrition levels are good. Now, when you're mounting an immune response, again, I can't give you specific data on this, but when you're mounting immune response, I think it's best not to do unnecessary exercise. So I won't be going for a jog or a long cycle today. I'm just gonna take it easy. Mind you, I don't need much excuse to do that these days, but this is a genuine excuse. So I'm not going to do vigorous exercise for the next few days as well. And there was also some data from Russia showing that alcohol reduces the efficiency of the immune response. So best to leave off alcohol for, well, as long as you, stop out, don't drink for the rest of your life would be the ideal situation. But certainly for the next 2-3 weeks, I won't be drinking alcohol. I'll just drink orange juice at nights or something like that. So those things can probably help boost the immune system. So just a personal note, but I was pleased about that. So it was just purely fortunate. I mean, I could have been out. Someone else might not have been on the end of a phone at the time, but I was around there in about 5 minutes, and 5 minutes later I had my vaccine. So good news. First dose. Hopefully get another one in 3 months. Right, that is us for today. Looking at a few interesting things for tomorrow. There's some talk about genetic factors influencing predisposition to COVID. So I plan to look at that. And there's also quite a few people have alarmed me that there's a recombinant virus that's been discovered in California, where two viruses seem to have fused together and produced a super virus. So at the moment, there's nothing about that that's worrying me particularly. But it is something that we'll have a look at, and it has got potential for the future. But we'll see how we go. Tomorrow's another day. Thank you for watching today.